So we are hardwired for a fear response. People shouldn't think of it as a flaw. In some respects, it's appropriate to have a fear response. It's protective, but in other instances, it's no longer a feature, but a bug. People with a history of trauma, as well as those who are high in neuroticism, more likely to develop a fear-based disorder, such as anxiety or PTSD. Fear becomes a hypersensitized response in anxiety and PTSD disorders because it becomes triggered by smaller and smaller stimuli as the disorder progresses. All of the anxiety disorders stem from some underlying fear. What would be more remarkable is how anyone can go through life without any fear or anxiety. The fear response in mammals is pre-programmed for our survival when a threat is observed. Humans, however, differ from other mammals in that our consciousness reminds us that we will eventually die. Therefore, our conscious awareness of this fact provides us no escape from fear of death, even when the perceived threat or predator is gone. Anxiety disorders that are predicated on fear are generalized anxiety, social anxiety disorder, panic disorder, obsessive compulsive disorder, PTSD, and other specific phobias. Fear originates in the area known as the amygdala. The amygdala receives input and some emotional stimulus via the thalamus, which is the train station for the brain. The amygdala can very quickly activate and release a number of hormones from the adrenal glands to start the physical manifestations of the fight or flight response. The memory area, called the hippocampus, allows the brain to give the situation context. Treatment for fear-based mental health conditions can be categorized into having three components: A, doing therapy, B, doing medications, and C, understanding the mind-body connection and really strengthening that. There are a variety of different therapy approaches for anxiety. For example, for generalized anxiety, one can do cognitive behavioral therapy, CBT, one can do acceptance and commitment therapy, or rational emotive behavioral therapy. All of them have different strengths. One mainstay therapy treatment for specific phobia and OCD is exposure therapy, where one is exposed in gradual amounts in very pre-planned ways to that which is feared. After exposure, the fear response becomes attenuated or lessened via habituation, and an individual becomes braver in taking on new challenges gradually. Medications to target anxiety disorders work on key neurotransmitters implicated in anxiety, such as serotonin, which is when we use selective serotonin reuptake inhibitors, norepinephrine, which is when we use SNRIs, GABA, which is when we use benzodiazepines, and then the adrenergic system, which is when we use beta blockers, such as propranolol. Mind-body strategies attempt to help break the physiologic cycle that can perpetuate anxiety. Biofeedback teaches individuals to learn the physical symptoms associated with anxiety. Other mind-body therapeutic techniques include EMDR and emotional freedom techniques. Are there any tips that I would give somebody to helping them alleviate their experience of a fear-based disorder? First, I would say, don't attempt to suppress the fear or anxiety, but instead embrace it in a way, accept it, dance with it, inspect it, describe it, talk about it, go after it, befriend it, do anything but try to suppress it, because that won't work and it'll just make you attend to it more. Second, do the opposite of what your brain is telling you to do. Try to reframe your fear response. It's telling you that this thing is important to you and it matters to you, and you have to figure out what that meaning or signal is to you. Lastly, I would say talk about it with somebody and help normalize it. To overcome fear, one must learn to not be afraid of your body's feelings. The more your mind focuses on your body's feelings, your racing heart, you're feeling hot and sweaty, shaky, nauseous, the more anxious you'll become. You have to embrace your body's response rather than reject it. You need to acknowledge it, but not respond to it. Don't let it be in the driver's seat. You could try to welcome the feeling as part of who you are and not something you're ashamed of. You can gently remind yourself that you're safe and that nothing will happen to you or your heart, and the feeling will pass as it always does. You should try to have compassion towards yourself. I know it's easier said than done, and treat yourself with loving kindness and tell yourself that whatever you're feeling is a product of your ancestry and has no bearing on who you are as a person and how kind and how loving you are.